Good morning, everybody. I'm so excited you're here joining us live right here from the ACU of Texas studios. Excuse me while I fix my headphones. It's the Kelly Williams Show, and we are tuning in and turning on our happy right here every Wednesday morning at 8 o'clock. If you haven't grabbed your coffee or your mimosa, well, guess what? We're not waiting on you. We're right here. We're already ready to go. So and guess what? We got a great show for you today. It is Happy Valentine's Day early to us. Because guess what? Dr. M, that's right, the one, the only, Dr. Molliver is in the house. That's right.
Woohoo! You know what? Remember J-Lo, and I've decided I think I'm going to go by Dr. Claymo.
Oh no!
Claymo.
See,
No,
I love it.
Do you like it?
I love it.
Okay,
Dr.
right.
Claymo
There
is
we
in
go.
the house.
All right.
That's right. Okay, this is awesome. So, I have one question. You know, since it's February, happy February.
Happy
by
February.
the way.
That's right.
Are you the love doctor?
I don't think I'm going that far. I don't think I'm going that far. I make lovely bodies, but I don't know if I'm going to the love doctor.
I don't know. I think that's your nickname this month.
Oh my
the
gosh.
Love doctor.
Oh my gosh. Like the Love Boat. Remember that?
Exactly.
Okay.
One of my favorite shows ever.
Of course.
That's right. Okay, so Dr. M, we are talking about fat grafting.
Right.
Is that the official name for it? Fat grafting?
Fat grafting, fat transfer. Those are the two. That's how we look at it. That's how we call it.
Yeah.
But people know the name Brazilian butt lift.
Yes.
That's the buzzword.
Yeah, and I didn't even realize until, I always do research.
Sure. You've researched this. I don't want to know what pictures you're looking at.
No, exactly. When I was looking this, I didn't realize that we had talked about this once before months ago, but I didn't realize that the Brazilian butt lift was fat grafting.
So that's true. People think it's some sort of lift or it's an implant or something, but it's not at all. Mm-hmm. It's fat transfer that we take from other parts of the body and put it into the butt.
Yeah, that's amazing. So if people have been thinking about lipo and...
Why throw it away?
Why throw your fat away?
We could either make soap out of it, or
what?
No, I'm only kidding.
I thought that was really. Well fat.
Yeah, I'm only kidding.
There's that gum, well fat, or something like that.
Let's not go there. Let's stay with the love doctor, okay?
Okay, we're gonna do love doctor stuff. Okay. So where? First of all, do you get the fat from?
Well, let's even back up a step back from that. And that is fat transfer. So fat transfer started, 30 years ago, but it wasn't as sophisticated as it is now. And that time, they would take fat or parts of tissue or whatever that we were taking out for some reason, and we'd stuff it in somewhere else in the hopes that it would do well.
There you go.
And it didn't do well. It didn't take.
Oh, that's horrible. But it was their own body.
It was their own body. So what happened was a little bit of tissue got left, and it was just scar tissue. It was hard, it was uncomfortable, and the doctors felt and realized that they had to put a lot more in because a lot of it didn't take, so that way sometimes you'd have some grotesque deformities because they put too much in, scar tissue, etc. And what's happened over the past decade or so is we've refined our techniques so that we can transfer different types of tissue, and specifically fat, to all over the body. So we use it to augment volume in the face, because as we get older, our tissue gets a little bit thinner, a little bit softer.
Yeah.
So we transfer fat in a special way. Sometimes we use centrifuge. Some doctors use centrifuge. Others, it's a very special cannula that you use when you're harvesting the fat.
Wow.
And it's washed and it's taken care of very, very carefully. So we can transfer fat to the face.
It's amazing.
We transfer fat to the breasts in breast reconstruction, and just regular patients who want some more fullness to their breasts. We don't have to use an implant.
Yeah.
Oftentimes we can just add fat.
That's incredible, really.
We add fat to the back of the hands. Your hands get, the skin gets thinner, the subcutaneous tissues get thinner, and you can see all your veins and whatever. So we can add fat to the back of the hands.
Incredible.
We add fat to different parts of the body, to the buttocks, etc.
Yeah.
Or to little areas that get depression. For example, we see patients that come in who've had an injection in their arm, in their butt, and they get a depression there from a steroid, for example.
Wow.
Or maybe there's an old injury. We can harvest fat and increase the volume in that area to bring it all up and lift it up and create a more normal contour.
Yeah.
So we're using fat all the time. The really cool thing is that it carries a lot of stem cells.
Yeah.
And so and this is a little bit controversial. I'm walking out to the edge here.
Walk to the edge, Doc.
But there have been a lot of anecdotal references and some research has come out that says that over time, this fat that's transferred improves the quality and the appearance of the overlying skin.
Wow.
From where it's transferred. So you start getting improvements in the appearance and the quality and the tone of the skin overlying the area where the fat is transferred. So it's phenomenal. And then we're doing different things with fat on how we manage it. So where we used to transfer fat to the face, and then sometimes we get little nodules, now we harvest the fat with special cannulas, and then we run it through different devices to make it smaller and smaller and smaller particles.
Wow.
So now we can put the fat literally up under the skin and it's very small particles, it's very smooth, and get phenomenal results.
Amazing.
Yeah.
Well, we have to say good morning to a couple of people watching. Hey, Mom and Dad, Amy, Beth, Terry, and Angie. Good morning. And Beth said there's no shortage of fat there.
Okay.
So,
so when friends come in with you, they can't donate the fat. Okay, that doesn't work.
See, I was just going to ask you that because I've got fat to donate.
we all, especially after the holidays, we all have fat to donate.
Exactly. Okay, so tell us who is a good candidate for this, because now that people who may have had no clue that this is even possible, how do they know if they're a candidate for this?
Anybody's a candidate.
Really?
Sure. So sometimes we see guys that have gynecomastia surgery. They have surgery to remove some man boobs, some breast tissue, and unfortunately, after that surgery, sometimes they're left with a little bit of a crater, a little bit of a deformity when they raise their arms. So those guys can be taken care of. We can transfer some fat into their chest area to smooth out that deformity, to smooth out that contour.
Yeah.
Women who have had breast augmentation and the edge of the implant is showing, we do some fat grafting around the edge of the breast to camouflage that, to smooth it out. So we use it all over the body now. It's just another tool in our armamentarium to help us reconstruct and redo and revise areas of the body. And of course, the biggest use of it, the thing that everyone is talking about, is transfer to the buttocks to make the buttocks fuller or rounder or less masculine. I think we've got an example over here. If you're watching, I'll show you on Instagram. Here's a picture of a fat grafting, buttock grafting, and what you'll notice is the hollows on both sides of the buttock. That's a little bit more masculine, and with fat grafting, we can round it out and make it a more natural, more feminine type of buttock.
It's really amazing.
I'd love to show you the lateral. Of course, we can make it, rounder and fuller and more projecting outward.
Yeah.
But this is a perfect example of how we can improve the shape of the buttocks. So if you're watching as well as listening, then you can see these pictures, or we'll post them on our Facebook site later on today.
Absolutely.
And maybe on Instagram as well.
Yeah.
So that's an example.
That's really amazing. Okay, so I have a question. Well, I have a couple of questions. When people get fat transferred to their face or their head, is that where fat head comes from?
Oh my God! You just don't. Stop.
It's
Stop.
Bad Joke Wednesday.
Bad Joke
Remember,
Wednesday.
I forgot to tell you that.
There you go.
Okay, so this is really amazing. So, what about people with like hollow eyes or things like that where it looks like they sit back and they cannot make anything fill out their eyes? Is this a great way for this?
It's a great area.
Wow.
And it's a bit more of an advanced technique, more sophisticated way of doing it.
Yeah.
There's lots of plastic surgeons who are they're afraid to go in that area.
Yeah. Wow.
But a half cc of fat, if you have those really, really deep set upper eyelids,
yes,
we can put a tiny bit of fat in there. We put it under the eyebrows because that area flattens out. The temporal area of the head,
wow,
where that kind of scallops or goes in as we get older, particularly women.
Yeah.
The facial skeleton actually shrinks as we get older, and it happens more in women than in men, as well as the subcutaneous soft tissues getting flatter and smoother.
Yeah.
So we add fat and volume all over the face. So
okay, so what's the layman's term for subcutaneous? Whatever you just said.
it's the tissue underneath the skin.
There you
Between
go.
the skin
I knew I'd heard it.
And the face. So here's an example. I've got another picture. This is an example of a lady that I did.
That's amazing.
And that's just fat grafting and laser resurfacing in the same setting.
Wow.
Now we could come back and do a face and neck lift at a later date, but this was fat grafting, laser resurfacing, where we added volume back to her face in the form of fat grafting, and that's really improved things. We could do a bit more in her nasolabial folds and the area around her her forehead right here. But one setting, laser resurfacing, and a lot of fat grafting to add the volume back to the face that you tend to lose as you get older. So we'll post those pictures as well. So those are examples. But there's more to it, obviously. And right after the break, look at me. I sound like I'm running the show now.
Oh, yeah. No, exactly.
We can talk
you kind
about
of are.
how we do the fat grafting and how and the things afterwards. And not all of it takes. It's variable in different parts of the face, hands, buttocks. The more movement you have in those areas in the postoperative period, the less the fat graft takes.
Wow.
So fat grafts in my hands around the mouth is really tough to take. So I actually prefer using fillers for lips, for example. You can put fat in the lips, and I do all the time. I put fats in earlobes, too.
That's amazing.
Yeah. Oh, yeah. When I do a facelift, oftentimes we have earlobes that are shrunken and get flattened out as with age. People remember Marvin Ziegler. I forgot his name. Those long earlobes. So sometimes we'll trim them back, but also we'll add fat to them to bulk them up and make them look more youthful.
Incredible.
Yep.
Okay, we come back from break. We're going to talk more with Dr. Molliver about fat grafting your own body and your own fat to make you look better.
Cool.
So stay tuned for more Kelly Williams Show right after this commercial break. All right, welcome back, everybody. This is the Kelly Williams Show. We're live from the ACU of Texas studios right here. And if you're just joining us, we're talking to the Dr. Clayton Molliver. That's his new nickname. He told us. And we're talking about fat transfer. It's really interesting because if you're thinking about liposuction, or even if you're not, you just want parts of your body to look better, he can actually do that with your own fat. I'm sorry, this is the coolest thing ever. Really. Get rid of two problems at once, or three problems at once.
That's exactly right.
So we have some people that have joined us. Hi, Shauna. Hi, Beth. Hi, Randy. And hey, honey, my husband. We have a question. Are the results of the fat transfer permanent or semi-permanent? Can you talk about that?
So it absolutely is permanent. Whatever it takes past about a month or 6 weeks, it's yours forever.
Oh, wow.
Now, a couple of caveats. Not all of it takes. All right. So some of it takes, some of it doesn't. It depends upon where you're grafting, but we can get maybe 40 to 60% of it to take. If we're doing the fine, small amounts of, especially fine fat grafting in and around the face and the eyelids, the temporal area, probably 80% of that takes.
Oh, wow.
So we get a good take. Whatever's take after a couple of months, it's permanent. Now, here's the caveat. If you gained a bunch of weight, that's going to gain weight. And if you lose a bunch of weight, it will lose weight also. So it acts just like fat from any other part of the body.
Yeah. So it's best for people to, if you're trying to lose weight or do something and change that's going to be a little bit of extreme, you might want to wait until you're through doing that.
Exactly.
I mean, because you, like you said, anybody is a prospect for this. It doesn't matter, but once you do it, it's going to change with your body if you do that.
Exactly.
That's
so
really
if we have a
interesting.
depression because of surgery or trauma or an injection, and we want to fat graft that area, and then you go on and lose 10, 15%, 20% of your body fat, that's going to sink in again.
Wow.
So we have to know ahead of time, are you losing weight so we can overgraft a little bit so it can come down. But sometimes a second session might be necessary. Some of these things can be done at a local. You don't have to be put to sleep.
Oh, my gosh.
So,
okay,
so
that's
we
weird.
can harvest a little bit of fat. We can transfer it to one part or the other, no problem. But this is what we do. We do, plastic surgeons do skin graft for burn patients, for other people. We transfer bone and do bone grafts and cartilage grafts. This is another tissue that we transfer around the body, and we use the same medical principles that we've learned and we've taught to transfer tissue everywhere, and that is you have to immobilize these tissue grafts so that you can get oxygen to sustain it and then blood vessels to grow into it.
Oh, wow.
So we have to know what bed it's going into.
Yeah.
So fat grafting really has been amazing for breast reconstruction or for radiated patients because we can bring tissue in there that helps the tissues become more supple, more soft, and of course fill out volume.
Yeah, that's incredible. And it can, if I want to go in and have you lipo my fat out and put it somewhere, is this all done in one surgery?
Absolutely, we do it all the time.
Wow. Okay,
so we lipo. For the most common thing is a young lady comes in, or a recent mom or something, and she says, my butt's become flatter, or I've got that no acetol,
Yeah.
no problem.
Yeah.
and I need more butt fullness. But
Yeah.
I've got fullness on my waist. I've got fullness
Yeah.
on the outer part of my thigh. My tummy's a little bit more full.
Yeah.
My weight's good. It's just not distributed the way I want it to be. So liposuction to the tummy, liposuction to the outer thighs.
Wow.
And for the buttock in particular, the way we shape a buttock is not just the fat to the buttock, but it's liposuctioning and sculpting around. So when we take a little bit of fat out of the hip, we bring the hip in the lower back, we bring that part in, that starts accentuating the butt. If we've got a little too much fat on the lower outer butt, we can sculpt that down, a little bit posterior thigh, outer thigh. Now we start sculpting out what the buttock should look like. In addition to adding fat to the buttock, we're also sculpting around it. So
Yeah.
we use liposuction in three ways. One, to harvest the tissue with our special cannulas and how we treat the fat afterwards. Two, to sculpt around where we're trying to create a volume increase. And then three, adding the fat back, both deep and superficial. And I might also add, and this is very, very important, our literature and the news around the country, around the world, has recently come around and started talking about some of the dangers of fat grafting, particularly Brazilian butt lifts. What you know as Brazilian butt lifts, or the public does. This is fat grafting to the butt. There have been, and it's very rare, but there have been deaths.
Oh gosh.
All right. So you have to be really careful.
Well, it is surgery.
It's surgery, but people are a little bit careless. They're a little bit gung ho, and you can inject fat into vessels. It can go to your heart and lungs, and it can kill you. So thank God God forbid, have never had that.
Yeah.
But this is training. This is how you perform the operation.
Yeah.
This is how much tissue you transfer in one setting or not. Maybe you tell people to come back. It's selecting the patients right. It's putting them on the table correctly. It's putting the cannulas in the correct spots.
Wow.
And so, a little warning out there. We're very aware of it as the Plastic Surgery Society. We're putting out white papers on how to be very careful about this.
Yeah.
And of course, do your due diligence. Find a board certified plastic surgeon.
Well, this is why they
experienced.
come see Dr. Molliver at HPRS.
Oh,
so
of course.
if they want to come in for a free consultation, how do they contact you?
Well, the best way to contact us is really through our website. You can see examples of my work or the work of my colleagues at myhprs.com, or you can call us at our number 281-282-9555. Any one of our 3 offices around the Houston area would be happy to see you.
Awesome. And good morning, Brenda. Brenda just joined us.
Hi, Brenda.
Okay, so we have another question.
Sure.
What about scars and incisions?
Sure. Well, scars and incisions, now we're getting into other areas.
Okay.
Certainly, if there's a volume deficit, as there often is, because the tissue was damaged or any number of reasons, we can use fat to bulk up that area.
Okay.
So again, it's just our armamentarium, our palette of tools. We have a scalpel, we have a laser.
Oh, so it's
we have
whatever you
fat.
end up having to use.
It's just another one of our
Okay.
tools. Now in addition to fixing up the skin, maybe excising a scar and resuturing it, or lasering a scar, or reconstructing the tissue under it, adding tissues, bringing in muscle perhaps. We use
Wow.
fat. So
Yeah.
we use fat all over the body. People use fat all over the face. In all areas of the body, we're adding fat back to increase volume.
Yeah, I mean, it's incredible. So the results vary. I mean, and does this depend on how much you exercise or anything? I mean, because I wanted to ask you that when we talked about it just a little while ago. Are we, like, if somebody's an athlete and they had some fat transfer done, is that going to affect their body on if once it settles into anybody, it's there.
It's there.
And that's
so
how
it
it's
doesn't
going to
matter.
look. It doesn't matter
if you're an athlete or a non-athlete.
Okay.
The fat's going to take, but it takes variably. We're going to look at the patient. Are they a smoker? Are they a non-smoker? Are they in
Okay.
good physiologic condition?
Okay.
The younger you are, the healthier you are.
Yeah.
The better you take care of it, the better the fat's going to take. And how it's done, how it's prepared, who does it, where it's injected. There's a lot of variables that come into play. Having said that, with a qualified surgeon and done correctly and maintained and cared for in the postoperative period, a great amount of it takes nowadays, unlike previously. I will mention one other thing. There's a company called MTF. They've been around for about, 30 or 40 years, and it's a nonprofit. They are the 800-pound gorilla, if you will, in the bone graft and tendon graft arenas.
Wow.
So if you get a ACL repair, you're probably getting a tendon from this company. And this is tissue that's been donated and then treated and whatever. They've been working on this for about 8 years or so. They just came out with a product, I believe it's called Renova. and Renuva or Renova. Do you remember?
I think it's Renuva.
I think it's Renuva. Anyway, it's a 3 cc syringe with fat that has been donated, but it's been treated very carefully. It's in, it's in tiny amounts, but that can be injected. And it's actually specially treated. We have to reconstitute it, and then we inject it. And then over several months, your body lays down fat in this substance that's injected. It's actually tissue from other humans.
Wow, that's incredible.
It's really incredible.
Yeah. Well, that may be good for my skinny friends.
Well, what I'm thinking is, what happened? That's a great point.
Since I can't donate.
That's right, because you're
them.
so slender. That's right.
Yeah, no. I don't mean that. You just told me that you can't borrow somebody else's fat.
No, you can't. But this is from somebody else, which is amazing.
That is incredible.
And I wonder if in a few years they can't provide it in bigger volumes.
Yeah.
And then we're fat grafting anybody, anytime. Because I get young ladies come in and say, "I've got no butt. I want a butt," and and they've got a very, very low BMI.
Yeah.
They don't have a lot of fat in their body.
Exactly.
I'm sorry, you don't have anything there to donate. Yeah.
Yeah, to donate.
That's right.
Well, okay, since this is February.
It's February.
It's February. Can you make somebody's hiney look like a heart?
I can. So that's a great question, Kel.
Thank you.
You have the most brilliant questions.
It's just who I am on Wednesday mornings.
Yes, Wednesday morning. So there have been studies to look at a broad range of people and say, what's the best butt? And of course, as you might imagine, people like big butts and little butts.
Yeah.
People like an upside down V.
Yes.
Like a heart. And other people like more of a shelf on top.
Uh-huh.
And so it's very important for us to say to a person, we take a picture of your butt and put it up on the screen and say, okay, what do you want to look like?
Wow.
Do you want this kind of butt or that kind of butt? It's not just, one butt fits all,
Yeah.
It's not true.
That's right. I actually saw that written on your wall. One butt does not fit all. I mean,
That's
that
right.
makes sense.
Well, it is. We have women try on breast implants. There's different types of breast implants. We're getting much more sophisticated. We just don't pump fat in the butt. We sculpt it. We're taking a little bit out here, putting a little bit there. So.
Yeah, that's incredible. And this has been so informative. Okay, so I have a question. How much do these things cost? What would somebody expect to be spending?
You always ask me that.
I know I do. And you can just give us a range.
I'm going to look over there. Give us a range. I'm asking my marketing director.
We're talking face, we're talking butt.
So it
ranges.
It ranges.
I want to say $3,000 to $10,000, depending upon how much, where you're doing it.
That's good because that helps people. So if they just want something done to their face,
if you're super wealthy and you drive up in your Bentley, the price goes up to about $35,000.
Oh God, that's all we needed to know.
Well, that's how it is.
Exactly.
Right.
Okay, Dr. Molliver, this has been so much fun. And
as always,
I have a little Valentine parting gift for you.
Let me put them on. Here we go. Take my crazy glasses off.
That's right.
I have to go to the OR now. Here we go.
He's going to leave and go do some surgery.
There we go. I'll walk into the OR like that. How do
nice.
I look?
Nice.
Everybody.
Well, we've enjoyed.
Here's your serious doctor doing your serious surgery.
That's right.
Okay.
And it is February.
Well, happy Valentine's Day.
Happy Valentine's.
To you and to everyone out there.
Thank you. You too. And if you've just joined us, we just got through talking with Dr. Molliver, and we hope you stay tuned for the next half of our show. We're going to have Asha Steele, and we're going to go to commercial break right now, but we'll see Dr. Molliver next month.